Hi, how are you? My name is Ty Morton, and I am a registered nurse at Weissman Children's Rehabilitation Hospital. The purpose of this presentation is to discuss Part 2 to management and treatment of clients with critical airways, mainly referring to patients with tracheostomies and may or may not be on a ventilator. It's important for us as caretakers to be able to care for these types of patients and be able to handle medical emergencies rather quickly and prevent harm from coming to the patient. What I'm going to use in this presentation is I'm going to talk about decannulation. I'm also going to discuss respiratory distress and how important it is to act fast. We want to prevent patients with tracheostomy and ventilators from becoming more hypoxic and ending up going into a cardiopulmonary arrest. So it's important that we act fast. And one big important thing that we have to do is not to panic, to stay calm. For purposes of this presentation, I'm going to use my friend here. I'm going to call him Baby S. And Baby S has a tracheostomy in a 3.5 Neo Bavona. He has a cuff trach. And depending on the doctor's orders, we have to look at what trach is ordered and if the patient has the right trach in. He also has a different kind of dressing, and depending on doctor's orders, they would determine what dressing to put under. Normally, it's either Aleve or Permafoam, used a lot for patients that have skin breakdown. Okay, there are many different types of trachs as well. There are fenestrated trachs, non-fenestrated trachs. There are cuff trachs, non-cuff trachs. And as you can see, he has a cuff trach. Okay, so Baby S here, looking at him may look like he's just asleep. But what you have to monitor when you go into a room is making sure that his coloring is good. If you look on his monitor and you see, okay, his monitor says he's 90%, you need to look at him. You need to look at his coloring to make sure he's not turning blue. Look at his chest, that is rising and falling and that it's not having retractions, increased work of breathing. If he's grunting, you also want to look at the demeanor of the patient. Sometimes if they're going through respiratory distress, their demeanor may change. They may look a little more irritable. And you want to make sure you check the patient at the beginning of the shift and end of the shift and on an as-needed basis. In everything, you want to make sure you're monitoring them closely. Okay, so looking at Baby S here, let's say he has a trach and you come into the room and you see this. And I'm just going to pull it out just so you can see what it looks like. It looks like this. So now you see that he has decannulated. Okay, you can't tell just by looking at him like this. So you have to literally look underneath the dressing to make sure that the trach is in, okay, and that it's intact. Okay, when you see this, it's important to act fast. Okay, needing help, you may need to press the cold bell. Okay, it's important to get extra help if needed. Okay, so you can press the cold bell. But you come and you find the trach is out. You need to put the trach back in quick, okay? The easiest way to do it, and I'm going to undo him, is to put the decannulated trach back in, okay? So let's say we're able to put the decannulated trach back in, okay? Put the trach back in. We want to secure it. I'm going to do the ties here. And then we want to check for adequate ventilation. Okay, it's really good if you have two people there. Someone can hold the trach while the other person makes sure the ties are secure. Okay, so this is where the importance of the cold bell comes in to get you that extra help. You want to check for adequate ventilation and oxygenation. Check the coloring. Okay, you want to make sure once you get the trach in and secured that you can get a finger through there and that the trach ties aren't too loose. A lot of times patients decannulate because the trach ties are either too loose, or if you have a patient that's constantly moving, it makes it a little bit more easier to dislodge the tube. So you want to make sure that the trach ties are tight. Okay? For any reason that you can't get the trach back in, Again, he has a 3.5 Neo-Bavona. You want to put a different trach in. Okay, so let's say we're unable to get this particular 3.5 Neo-Bavona back in. Now it becomes necessary for us to put another trach in. Okay, so we're going to say that this is another 3.5 Neo-Bavona. Okay, a lot of trachs are going to come with an obturator, and an obturator looks like this, and it's a tube that goes in to help passing the trach in a little easier. Okay, each patient that comes into Weissman should have an emergency red bag with them, and inside the red bag is going to be a trach of the same size, so he should have another 3.5 Neo-Bavona in the bag, as well as a 3.0 Neo-Bavona in the event that we can't pass the same size tube in. Okay. Also, they're going to have Surgilube, trach ties. They may have sterile normal saline. They're going to have gauze if needed. There should be an oxygen source available. There should be suction available. Okay, and there should also be an AmBlue bag located in the red bag. Okay. So if the patient's unable to pass a 3.5 of the same decannulated trach in, we're going to try to pass in a trach of the same size. And we got it in. Once we got it in, we want to check for ventilation. We want to secure with the trach ties, check for tightness. But before you do any of that, it's important to remove the obturator as soon as you get the tube in. The reason being is because patients can't breathe with this in. So until you take this out, they're not going to be able to breathe. So once you get the tube into the patient, take the obturator out. Okay? Check for ventilation, secure the tube. Secure the tube, check to make sure you can get a finger through there. Okay? And then once you do all of that and everything looks good, then you can put the gauze in if need be. Okay? But let's say you come in and you've tried to put the decannulated trach in. It was unsuccessful. So you used a new trach and you tried to put it in and it was unsuccessful. Now you need to get a smaller trach, which would be a 3.0 Neo-Bavona. Okay. And try to pass it in. You want to make sure when you're putting the trach in that you're going in and downward, okay, into the patient. All right, same thing, check for adequate ventilation, oxygenation, secure the ties, check to make sure you can get a finger through there, check for tightness. Okay, check coloring, check the patient, make sure they look okay and that their numbers are okay. All right, and then we're good. If for any reason we can't get the same size trach in, we can't get the smaller size trach in, it may be necessary to AmBlue bag the patient. We need to manually ventilate the patient to make sure that they're getting the oxygen that they need. We want to prevent them from becoming more hypoxic, which can lead to cardiopulmonary arrest. And now we have a real medical emergency on our hands. At that point, we need to get them out 911. Okay, it's important for us to stay with the patient. Someone needs to stay with the patient at all times. Okay, make sure you stay calm, that you don't panic, and get help when needed. A lot of times we have patients that come in, they have a trach and may or may not be on a ventilator, that are going through some type of distress. So even if you come into a patient's room and the trach is in, okay, and you look and you're managing the trach, you're looking at their airway and everything seems to look okay, but they're still going through some distress, and you look and the trach is in, they're just going through a little bit of distress. Now we need to handle why they're going through the distress. So we're going to say, let's say we have the trach in, and I'm going to put this trach into the patient just so that you can see. Okay, we're going to secure his ties. Okay. So we've come in and the patient is going through some distress. You look at their monitor says 90. They're not coming up, okay? Their coloring looks a little off. They're a little dusky, or maybe they're a little blue. Having some retractions. They're doing a little bit of grunting. Their breathing is increased, so they're having some increased work of breathing. Something doesn't seem right. We need to look at the patient. We need to look. The trach is in. Okay, again, if they have a piece of gauze here, you want to look underneath to make sure that the trach is patent. Okay, that it's in and everything looks okay, but the patient still doesn't look good. Maybe they're having an obstruction. Okay, so we could try and suction them. Okay, you want to use a suction tube, and a lot of times the patients have pre-measured suction. Okay, they're suction with a certain size French trach. Okay, to a certain centimeter, depending on what's ordered. Okay, you want to suction the patient. You've suctioned them, and they still don't look too great. Okay, they may need a little more oxygen, maybe another nebulizer treatment. Again, get help if needed. Okay, get someone to come in and help you. For purposes of him, we're going to say he has a cuff trach. He had a cuff trach before. So let's say he has a cuff trach. If he has a cuff trach, it's necessary to deflate the cuff. Okay, let's say he has a trach that has an in-ear cannula in. You need to take the in-ear cannula out. See if that helps with the obstruction. You want to suction the patient. See if that helps with the obstruction. If they're still not looking good, you can't bypass the obstruction, it's necessary to change the trach altogether. So now you want to put a new trach in again. Again, if you cannot get the same size trach in, you want to try to put the smaller trach in. Okay? At all times, you want to check for breathing. Okay? Check the trach, check their mouth, check the rise and fall of their chest. You want to check for breathing. Okay, if for any reason you've inserted the trach and they still don't seem to be improving, okay, now we have a medical emergency. We need to get the patient out. Someone needs to stay with the patient at all times, and then we need to activate the emergency protocol. Someone else needs to be delegated to get the paperwork started, okay, or someone delegated to stay with the patient, but someone needs to stay with the patient. In everything that we do, we want to make sure that the patient is receiving adequate airway management, and that's very important to prevent future harm, okay, further harm from coming to the patient. We want to make sure we act quickly because a tube can be partially obstructed, and if it's partially obstructed, it can lead to a medical emergency, or it can be fully occluded and we're already having a medical emergency. But in everything, we want to make sure that we're preventing these medical emergencies from occurring the best way possible and giving the optimum level of care that we need. If we're not able to get the trach back in, we need to ventilate the patient. And if the patient is still not doing well, we need to get them out of here, okay, and call a code and get them to another hospital as fast as we can. Okay, and that includes the presentation. If you have any questions, please feel free to contact me. I also have an email, mcbridetie@gmail.com. You may also consult with the respiratory therapist that's on, the director of nursing, Dan Pfeffer, as well as Crystal Rossi, the nursing supervisor. If you have any questions regarding decannulation, please feel free to give us a contact. All right, thank you very much for your time. Thank you. Have a good day.